Hello, a warm welcome to you from SGT University. I am Abhishek Mishra from Faculty of Nursing. Today I am going to discuss about the topic of blood pressure. Blood pressure is the pressure of circulating blood against the wall of the blood vessels. Most of the pressure results from the heart pumping blood through the circulatory system. When used without qualification, the term blood pressure refers to the pressure in the large arteries. Blood pressure is usually expressed in terms of the systolic pressure, that means minimum pressure during one heartbeat, over diastolic pressure, minimum pressure between two heartbeats. In the cardiac cycle, it is measured in millimeter of mercury, that is mmHg, above the surrounding atmospheric pressure. Blood pressure is the force on the wall of the blood vessel by the blood as it pumped around the body by the force of ventricular contraction. Pressure of the blood as a result of contraction of ventriculars. Normal range of cardiac output 90 to 140 mm of Hg. It is the pressure when the ventriculars are at rest. Normal range of cardiac output 60 to 90 mm of Hg. Denote the difference between systolic and diastolic pressure. Wash and dry your hand. Prepare the patient for the procedure. Ask the patient if he or she has ingested caffeine or has smoked within 30 minutes prior to measurement. Allow the patient to rest for 5 minutes, either supine or sitting in a quiet room with comfortable temperature. Comfortably position the patient sitting with the arm supported on the table at heart level or lying down with the arm resting on the bed and has the palm of the hand facing upward. Position the knee slightly flexed. For popliteal BP checking, patient should be instructed to keep his and her feet flat. Remove tight clothing from the limb to be used and support the limb. Apply the correct size of sphygmomanometer cuff 2.5 cm above the antecubital fossa directly over the patient's skin and in level with the heart. Ensure the level of mercury meniscus in the manometer is at the nurse's eye level. Locate the radial or brachial artery and inflate the cuff until the pulse can no longer be felt. Deflate and wait 15 to 30 seconds before processing. Palpate the brachial artery and place the stethoscope gently over the brachial artery. Inflate the cuff to 30 mm of Hg above from the previous step. The cuff is deflate at a rate of 2 to 3 mm of Hg per second and the cork of sound listen. For the cork of I means when sound first heard is equal to systolic value. Cork of V means when last sound is heard is equal to diastolic value. Record the systolic and diastolic pressure in the nurse's chart and on the vital record. Documentation the arm used and patient position. Compare with previous reading. Inform the appropriate personnel of any irregularities. When BP has to be read from the continuously cardiac monitor, do the following. The cuff has to be treated constantly. The cuff needs to be changed from one arm to another secondarily. Set the monitor to read the BP as per patient condition. So today we covered about blood pressure, and next time we meet we will discuss about angina pectoris. Till then, keep learning, keep growing. See you next time.